So happy to be here. And just to tell you a little bit about myself, I am a certified diabetes educator by profession. I'm also a certified health educator, one of the few African American certified diabetes that I've seen when I go to different places. And my job is to provide knowledge, tools, and resources to people. Doctors refer people to me for a number of reasons: blood pressure, cholesterol, diabetes, and obesity. Those are the four main areas that I've been working in for 20 years. And I just want to say, be careful who you listen to, and be careful about information that's coming to you, because people are saying things that are very, very strange, very strange. No disrespect to the speaker that just left, but a lot of what she was saying was not scientifically appropriate. So what I'm saying to you is, when someone is giving you information, the first thing you should do is to ask that person or go find out what is the scientific evidence for what you're saying. Just like we do in Islam. If someone is telling you something in Islam, where is your proof? Where is your dalil? What you're telling me, give me the proof of what you're saying. You know, people can tell you things, they can tell you their opinion, and that's fine. We all have a right to our opinion. But opinion should be backed up with facts. When you're talking about medicine, you're talking about the human body, you're talking about medications, you're talking about doctors, you're talking about people who are giving you prescriptions. And I'm not saying medication is perfect. I'm not saying that. I have one of my patients here as a witness for the work that I do. She came over here from Suffolk, and she's been with me for maybe 4 or 5 years. And when she first came to me, she had diabetes. A lot of people have diabetes. There's an explosion of diabetes. And the next wave of sick people that's coming are the young folk now. I'm seeing young people with old people's diseases. I've never saw that before in my whole career. I started working at the place where I work, Southeastern Healthcare System, in 1998. I graduated from ODU with a graduate degree in health science and an undergraduate degree in biology. And I've been working there since 1998. And I've never seen the type of medical problems that I'm seeing with the young people. I've never seen that in my whole career. We're seeing young people with cholesterol problems, hypertension, obesity is a huge problem in this country. And I think part of the problem was COVID. People were shut up, and they were eating a lot, and all kinds of stuff was going on in households. And consequently, our children are having a lot of problems. Obesity is a big problem in this country, we all know. And how do you deal with obesity? That's a complicated question, because everybody's different. Everybody's weight situation is different. But my patient came to me in 90, I'm not sure, I don't remember the year, but she was diagnosed with diabetes. A lot of people are diagnosed with diabetes. And diabetes is a disease that you just don't wake up with diabetes. You don't wake up one day and say, I have diabetes. It doesn't work like that. I like to say it's a creeping disease. Diabetes is like a weed growing up on the side of a building. It's creeping, creeping, creeping. And so your blood sugar could be creeping up for years. You may not even know it. You may not even know it. So if you're not going to your doctor to get your checkups, and you don't know how to read a lab report, most people don't know how to read a lab report. This is so important, and I teach my patients how to read a lab report: comprehensive metabolic panel, your lipid panel, your A1C. All these are the numbers that we use to judge your health. We're judging your health when you come to us, and we're looking at your numbers, and we're giving you sometimes medications based on your numbers. And so if you understood your history, your numbers, as your blood sugar could be creeping up, and there's a condition called prediabetes. I'm sure maybe you've heard of it. It doesn't mean you have diabetes. Prediabetes is not a disease, but is a risk factor for diabetes. So people come in with a prediabetes diagnosis. What does that mean? Well, your blood sugar is just slightly above, below 5.6. I don't know if you know about A1C. But A1C is a number that determines what your average blood sugar is over a 3-month period. And the reason that it does that is we have red blood cells that live about 3 months. And as these red blood cells circulate through your body, they soak up sugar. And we can measure how much sugar they soaked up over a 3-month period. And we attach a number to that. That's what that A1C is, hemoglobin A1C. So we look at that number could be creeping up, even in the normal range. But you may not know it if you don't know how to read a lab report. But once it crosses 5.7, it reaches 5.7, that's what we call prediabetes. Prediabetes is 5.7 to 6.4. But the doctor may not say anything. That's possible. I mean, doctors are busy. I work in a very, very, very busy practice. And because of that, sometimes people are rushed through the system, and the doctor may not have time to go over your lab report with you. If you don't know how to look at your lab report and say, wow, why is this number creeping up? Why is this number creeping up? You may not even know until it crosses the threshold into diabetes. It crosses the threshold into diabetes. But maybe even before then, something could have been done. So I agree with that. Something could have been done maybe before this. My patient here came to me, her A1C, I think it may have been 6.8, which is slightly above the scale. So she lost about 40 pounds. And she's right here. She can tell you. She lost about 40 pounds. Her A1C starts to go back down. It starts to go back down to the point that she doesn't even have diabetes. Not to say we cured diabetes, I'm not saying that. But what I am saying is a lot of these diseases can be fixed with lifestyle. That's what I'm saying. I'm not bashing doctors or medication. We need medication, but maybe not all the time. But there's a lot that you can do on your own. There's a lot you can do. But diabetes is an illness that requires knowledge to manage it. And if you don't have the proper knowledge, if you're not getting the knowledge, then maybe you don't know how to manage your diabetes. I see this every day. So people come to me, and I say to them, the first question I ask, what is diabetes? I'm asking you, what is diabetes? Somebody tell me, what is diabetes?
You're not producing enough insulin in your body.
That could be true. That's a good answer. Not producing enough insulin. Anybody else?
Not producing insulin at all.
That's type 1, correct.
Yeah.
She said not producing.
Not producing insulin at all.
That's right. That's type 1 diabetes. Not producing insulin at all. If you don't get any insulin, you will drop dead. You have to have insulin. The insulin is made by the pancreas, not by the liver. Insulin is made by the pancreas. Beta cells in the pancreas makes insulin, not the liver. Okay, what did you say? You had your hand up?
Yeah, is it not processing carbohydrates?
Well, not necessarily, but it could kind of. Well, this is my definition of diabetes. When someone is diagnosed with diabetes, they have too much sugar in their blood. Too much sugar in their blood. Classic diabetes. Too much sugar in your blood is toxic. It's toxic. Too much sugar in your blood is toxic. And I don't mean sugar like sugar, table sugar. I don't mean sugar like that. But to your point, when you eat carbohydrates, the body breaks these carbohydrates down and turns them into sugar. That's what we call glucose. Insulin brings this sugar back down. You eat the food, body turns it into blood sugar goes up, insulin brings it back down. That's what insulin does. It keeps your sugar balanced. That's why we need insulin. You have to have insulin. How does it do that? Well, insulin is like a key. It opens up your cells so the sugar can go in. That's what brings it down. But sometimes, as you said, the body's not producing enough insulin. Imagine that you're eating your carbohydrates, you're eating your rice, or you're eating your corn, and you're eating your bread, and you're drinking your milk. Milk is a carb because it has sugar, lactose. You're eating all these different foods, and your body's turning these foods into blood sugar, and blood sugar's going up, and so your body has to produce insulin, your pancreas has to produce insulin to bring the sugar down. And you continue to give your body this blood sugar's going up, and your pancreas can't get tired. Beta cell exhaustion. That's what that's called. The pancreas can't keep up. You're dumping so much in your system, the pancreas cannot keep up. So eventually it becomes exhausted. It cannot keep up. So blood sugar starts to build up. That's one problem. The other side of it is sometimes the cell itself, the receptor on the surface of the cell won't allow the insulin to bind with it so the blood sugar can go in. What causes that? One big problem that we see a lot. Belly fat. Belly fat is a huge problem. Belly fat actually can cause a problem with diabetes. Belly fat can do that. Belly fat is a huge problem, and we know as we get older, most of us will get some belly fat. Different things can cause belly fat, but if you have an issue with belly fat, then there are some things you can do. So people come to me also for weight loss. As my patient, Ms. Williams, she lost 40 pounds, and I looked at her A1C, maybe the last one she did, maybe 3 months ago, it was 5.2. 5.2. No medication, so people can manage their diabetes. Some people, not everyone. Some people can manage their diabetes with a lifestyle, meaning exercise. When I say exercise, I'm talking about cardio, sweat. You got burns, you got to break some sweat to build fat. That's what I say. Cardio, 150 minutes a week. The minimum is 30 minutes a day, 5 days a week. Not only that, but women need to lift weights. Women need to lift weights, build muscle. Muscle helps to burn fat. Build muscle, lift weights, and nutrition is the other important part of it. So I want to pass out some information here while I try to get this PowerPoint going. So somebody can pass this out for me, please. And this what I'm about to give you now is probably the most important thing I can tell you. To learn how to read a food label. Okay, while you're looking over that, I'm going to see if I can get this going. So Ms. Williams, maybe you could just briefly tell them what did you do to get your A1C down to 5.2? What did you do to get your A1C down to 5.2?
Well, I changed my eating habits and started getting more active exercising. Mainly it was changing my eating habits because food that was triggering my like sugar, cookies, and things like that. I changed by not buying that and having that as a part of my grocery list in the house because I knew that things that I really, really love, I couldn't just go to the bag or something like that and eat one. But in the beginning, I just decided to sacrifice not to buy those type of things at all. That I had a weakness to. So mainly it was changing my eating habits and trying to eat more vegetables and not a lot of powdered sugar, things like that. So that really, really helped me. That's what did it for me.
Thank you, Ms. Williams. And she's just one of many patients that I have that I've been seeing for a number of years. So if you have diabetes, if you have high blood pressure, if you have a cholesterol problem, if you have a weight problem, ask your doctor to refer you to a nutritionist. That is a person that you need on your team. Everyone needs a nutritionist. You need a workout person. You need to know how to work out, whether it's going to a gym or working out at home or whatever way that you work out. But everyone needs to build muscle and burn fat. We all need to do that. We need resistance exercises. We need cardio. And if you have insurance, you have access to a nutritionist. If you have diabetes, you have access to a diabetes educator. Diabetes is a disease that requires knowledge, as I said. I call diabetes a frenemy. A frenemy. Have you heard that term? Frenemy. It's a friend, and it can be an enemy. It can be your worst nightmare, but it can be your best friend. How could diabetes be your best friend? How could that happen?
It alerts you to something going on.
It alerts you to something going on? Actually, people come to me with diabetes, and once we figure out what they need to do, we come up with a plan for them. Every person is an individual, so every person's care has to be specialized for that person. That's why diets don't work, because a diet is just some general information, but your weight may be specific to you, your genetics, your lifestyle. So everyone needs a trainer. Everyone needs an educator. These are people that you need on your team. So make sure you ask your doctor to refer you to a nutritionist. That's extremely important. Because if you don't understand diabetes, then how can you defeat an enemy you don't understand? So learning about diabetes is extremely important. But what diabetes can do, if you come to me with diabetes, managing diabetes, learning what you need to do to manage diabetes will make you a healthier person, because you're understanding nutrition. So when you look at that food label that I gave you, let's just quickly go down some facts on this. So this is a new label. Does everybody have a copy? This is a new label. All labels don't look like this. Some labels are changing. This is the new look. It says here, the new look. But the old label, the letters are small, the weight is small, and I think this is my own personal opinion. I don't think that the nutrition facts label was meant to be easy to understand. I don't think. And the reason I say that because it's grams and milligrams. We don't do the metric system in this country. So if I'm telling you, or you can do 25 grams of sugar in a day, which you can. Our bodies can handle some sugar. I mean real sugar, real white sugar. Our body can handle some sugar. Women can handle, this is coming from the American Diabetes Association, you can Google it. Women, you can consume about 25 milligrams, which is the same as 6 teaspoons. 6 teaspoons in a day. One Pepsi 12-ounce soda has 39 grams of sugar. So if you drink one soda, you've exceeded your sugar consumption for the day. If you're drinking soda, soda is at the bottom of the trash pile, in my opinion. And next to that is pizza. One 18-inch pizza has almost 5,000 calories. And these are fat, grease calories. Soda and pizza. So, when you look at this food label, you see, and that doesn't mean you can never drink soda, you can never eat pizza. It doesn't mean that. But soda and pizza, these are celebration foods. Here's an eye every day. Celebration, moderation.
Just don't drink the whole bottle of Pepsi or a little bit.
Right. Well, I mean, if you're asking me, soda is something that you would drink 4 ounces if you were somewhere and they have some soda and you just happen to be there and you want something to drink. You drink your 4 ounces of soda, other than ginger ale. Ginger ale still is highly infused with sugar. Ginger ale is when you're sick on the stomach, not chilling drinking ginger ale. That's not for that either. That's not for that either. Yes.
You said 6 tablespoons?
Yes, 6 teaspoons. 6 teaspoons.
So does that mean for the whole day of all carbs?
The whole
or
day.
Just sugar?
Just sugar.
I mean, or anything that would turn into sugar?
Well, anything that has sugar in it.
Okay.
Like sugary drinks. So when you look at this label, let's look at this label, just to your point. Look all the way down when you see total carbohydrate. And we could do a class on carbohydrate. One of the most misunderstood food concepts on the planet. And people, they have these weird ideas about carbohydrates. You can't do carbohydrates. What, you can't eat fruit? You can't eat fruit?
Some people can.
Some people can't?
Cannot.
Oh, cannot eat fruit.
Yeah, I met a dietitian that she's managing a senior complex.
Uh-huh.
And some of her patients.
You mean they have a food allergy?
Well, she said they couldn't eat certain fruits and vegetables.
Well, if you're a diabetic, if you have diabetes, fruit has sugar.